the mind is the final frontier. Everybody says space is the frontier. I think there is a frontier within us. In a way, when you look at the vast sky, you feel that it's actually a vastness within you. Your sense of being, your sense of something that is not tangible.
You're listening to Conscious Mind.
Hi, everyone. Welcome back to Conscious Mind on Silver Hill Radio. Today we have a very special guest, Dr. Suma Srishaila. She is the medical director of the Argent Program here at Silver Hill. So I'm sure you've listened to the show before, and we have a bit of a format, but really mostly we're here today to just have a really great conversation and talk about you and your interests and psychiatry in general. So if you would get us started by taking us back to the beginning and what inspired you to pursue medical school and in particular psychiatry.
Well, first of all, good morning. Hello.
Good morning.
Pleasure to be with you guys. Yeah, quite the question because it's taking me back, as you say. I guess I've always enjoyed being with people and kind of spending time around people. But probably I grew up in India in a small, back then it was a sleepy little town called Bangalore. But then at some point became one of the, IT hubs along the way. So I think the first time I really sort of just lit up because I tended to be passionate about many things. There was this medical school by us, and they were celebrating, I think, their 50th or something year, and they had invited the public to, exhibits. And I remember going through an anatomy exhibit, and I think I was 9, and I was like, this is it. This is what I want to do. And I think I was surprised, but it kind of stayed. So medical school felt like it's all I want. It is what I want to do. It's hard for me to tell. It was something very organic there. Psychiatry was not entirely that way. I think when I started medical school, I was quite convinced I would be an ophthalmologist or a surgeon. Both bad professions for me because I'm not so good with my hands.
Or your eyes?
My eyes, okay.
Yeah.
But I think as part of our being in, we have rotations where we spend time in the rural, like villages and I was a huge advocate of public health, so I would participate heavily in that. And then I remember going to a small home with, about 7 kids, joint household, must have been about 15 people, tiny little, maybe 400, 700 square feet less. There was cows, there was cattle, all of that in the space. And I had to talk to them about immunization because that's what I wanted to do and that's what I'd signed up for. And I was getting so much pushback on that. And I realized that it's not possible to address medicine without understanding human thinking and human behavior. And I guess that's maybe where the seeds began. I think it helped also that my grandfather was one of the earliest psychiatrists in the country and is sort of, one of the grandfathers of psychiatry.
Wow, so I had no idea about that. Can you tell us a little more about that?
So my grandfather was a well-known primary care physician. And then somewhere in his 40s, he had a huge practice. And, back in the day, it was the normal Rockwell bag that you kind of carry, the doctor's bag, and you go house to house. He would spend the nights in a house where someone was sick. Apparently, my grandmother's lawn was always with people, patients. They would come at all times to the home because the practice would come from the home. And then in his 40s, he again realized, I found that out later in life as I was growing older, that he realized that there were people for whom medicine alone was not, addressing the whole picture. So in those days, he came to the United States, and because psychiatry didn't exist as a field, and then he did a fellowship here in Cincinnati, and then returned. Apparently, my grandmother visited by boat or ship or something back
Wow.
then, because flights were not the case, and he had 5 children who stayed behind while he did this for 2 years, and went back and upended the norm by starting psychiatry
In India.
in our town.
your
I'm
town.
sure in the country there may have been few, but there were not
that
that
many.
many. And then with his medical practice, the psychiatric practice began to emerge. I believe he saw antibiotics and Haldol first come,
Wow.
and then a lot of people were coming in secret
Really?
because,
Just because
in
of
those days. So,
stigma and
so for us growing up, it was very common for me to, go and see my grandfather because I'm worried about my exams or something like that. So I think psychological mindedness was within. So it was later in my life I realized that I probably always may have, knowingly or unknowingly,
you
wanted
had it.
that.
You had it in you. Yes.
Wanted that, or had
Yes.
seen that, make a difference. He did know that I became a psychiatrist, and I think we would talk.
So he lived long enough to see you become a psychiatrist?
Yes.
Oh, that's so special.
That was special.
Oh,
So
wow.
maybe too much information, but
No, that's fascinating. See,
Yeah.
this show takes us in such interesting directions because we don't.
yeah.
There's no script for this. We're just talking, and you learn
Right.
the most interesting things about people.
Right. So there was also not many institutions that taught the field. So he was a integral part of one of the very well-known institutions, National Institute of Mental Health and Neurological Sciences, in the town where I grew up. And so they would see patients, and then in their spare time come and teach. I, as a young girl, had seen one of the first long-term care for schizophrenia and bipolar patients at the back of his multi-specialty practice. They would stay and live there because they couldn't live in the home. So as a young girl, I learned classical Indian dance. I used to go and, I think I was 12, 11, I used to go and dance for them. And then I used to teach them how to dance.
Wow. So the patients, you would dance for them and teach them
Yes.
how. Wow. That's incredible.
So I started seeing a bit of schizophrenia and
Right.
bipolar, more chronic psychiatric illnesses.
When you were very young
and the people who cared for them even back then.
and from a different lens too, as a young girl and dancing and now look where you are. I mean, primarily the patients you see here are patients with schizophrenia or psychotic disorders or bipolar disorder is something that we treat here pretty regularly at Silver Hill. It's an interesting segue into where we're going to go next. Is those are, known to be difficult to treat disorders. We're going back in the time machine years and years ago now when you were seeing these patients in India, and here we are now in 2024 in New Canaan, Connecticut at Silver Hill Hospital. What do you see as the big changes in treatment since then? And where do you see treatment going, and do you anticipate any breakthroughs or big changes in the way that we treat patients with these really difficult disorders? So you've seen, many years ago what people were struggling with. You see it now and kind of anticipating what it might look like.
Right. I think, like many things, the illness has not changed. These are what we call primary psychotic illnesses, which would mean, that the way a person begins to think and experience the world around them and how they experience themselves in this world, every aspect of the world around them, there is a lens with which the biochemical change has altered that in a manner that is quite pervasive and at various points can get intensive. So the illness by itself has not changed. And I would say with that, the experience that the individual or the suffering of the loved ones as they go through, this journey with this illness and with the systems that are, in place in terms of hospitals, inpatient care, outpatient care. So that journey may have changed a bit, but the journey of the loved one, because the illness really starts, somewhere late teenage years, it shows itself. Illness has not perhaps really changed, but I would like to think our understanding of the illness has definitely grown. We are more understanding, and hopefully the people who experience this are more understanding of genetic underpinnings. They didn't ask for the illness, they didn't choose it. The same illness in siblings may or may not be there. So the genetic kind of, not entire randomness, because the genes seem to have a reason why it happens,
Right.
just like storms have a reason why they happen, but it's random to us, not random to nature.
Right.
So that I would hope has changed. I think there has been a lot of growth and evolution in understanding so many pathways biochemically as to where it has come. And as a result, as I may have mentioned, just like Fleming brought antibiotics and it changed how we saw illness. I think it was Joseph Lister who realized it's bacteria in our hands that are really, causing these patients to become septic and, that. So I think Haldol, although it's not everyone's like, if you say Haldol, everybody freaks out. But the idea that medications can impact this, because back in the day it was just talk to them and do psychotherapy. Right.
Wasn't it, from what I remember in my studies, wasn't it kind of an accident that people discovered, I think it was it Thorazine or Haldol, like one of the drugs was used for seizure control or something,
Exactly.
And they realized, this also helps with
that,
psychosis.
Right. But the idea that there is tangible ways in which you can help, I believe that. And now there have been more iterations of, more fine-tuning, if you will, of the treatments, which I think is rewarding, because we can tell people you have an illness like diabetes, like asthma. It's not like pneumonia where I can give you antibiotics and you will be okay in so many weeks. You have and we have a way to treat it, but the modality of the treatment. So I think those changes have been very rewarding. I still think, to me, the mind is the final frontier. Everybody says space is the frontier. I think there is a frontier within us, and maybe space represents what the outside. In a way, when you look at the vast sky, you feel that vastness. It's actually a vastness within you.
And the brain is vast.
That's what you're experiencing.
We don't understand most of it, from what I understand.
And consciousness, like, your sense of being, your sense of something that is not tangible, which you can't touch, but you can feel, you can experience, you know. Mm-hmm. So I do think that is really a frontier, and probably the, penultimate or ultimate frontier.
Right. And people that have psychotic disorders have perceptual changes, right? And differences in perception, and what makes that a disease versus everyone perceives things differently to an extent. Mm-hmm. So is it because of the difficulty functioning in society and fitting in and being like the majority of people, that perception is seen as a bad thing?
I think that's sometimes the way in which it tends to be framed. The actual experience is there is a skew, if you will. I think if you remember your Halloween mirrors, you do look a certain way, but if you look at yourself in the Halloween mirrors, you can look elongated, you can do that, but that's not actually how you look.
Right.
You really do have a form. Now, a philosopher will talk about it primarily as, that's what your eyes see.
Exactly. I was going to say, is that how our eyes have developed to see?
Right.
Is it really this form?
Right. In the truth, though, is that there is a form that is, generally being perceived, but the Halloween mirror is having you perceive that form. So in some ways, the people who experience the illness, and then the reason I think we have a while to go is the holy grail of many things is our ability to intuit, introspect, reflect. With most illnesses, you will see a cut, or you will see something growing, and you'll be like, "Oh my God, what's happening? I think I should go to the doctor."
Yeah.
We're putting aside some of the challenges about going to a doctor, but the general feeling is that, however, in these illnesses, the hallmark is that gnosia, which is to know, and anosognosia is to not even recognize. And that becomes almost baked into it. So the holy grail of the treatment, which begins to help us start seeing, this is sort of why I was thinking that way then, but now with treatment, I can see that, whatever it is, that skewed thoughts or the disordered thoughts. So our medications because these neurological, maybe partly conscious philosophical pathways that make us who we are and see the world, it is still, there's a lot to be understood and then done.
Right. And that's really fascinating what you say about the medications and the insight, because I know that when someone is really deeply in their delusions, right, in things that they believe to be true, it's really hard to get through that. You can't really just convince the person, "Oh no, don't worry, that's not actually happening to you." They're not going to believe you, because that's a very kind of stuck place to be. But the medications can help people to develop that insight and to be able to look at things differently and recognize, no, that thinking really wasn't how things are.
Yeah, absolutely. I think when they're there, it's almost, that's the way the brain is. It feels, the mind experiences. So it's as tangible to the individual, like the sky is blue right now, and that experiences it's pink with polka dots.
That's what it is for me. That's what it is. Yeah.
So, and the reason we can say that there is that change is because we see that change, and we see it to the point that when they feel improvement and change, they will be able to either experience surprise, or even shock, or even humor sometimes, and oh my God,
did I really believe that? Or
and their ability to do things begins to shift, because eventually this is not about what you see, but then how you then begin to be able to do, interact, and be more towards the person that you're skewing to be. And that is where I think the change in the treatment has grown. Room to grow more, because I still think it is a universe, this frontier of the human mind and the human conscious. So so the idea that I think we've just barely started getting a peek into it.
Yeah, and there's really with some of the medications still, there's still physical side effects that we have to deal with. So patients that are getting much better on the psychiatric end of things with some of these medications then have to have regular blood draws and make sure that physically everything is okay. And how great would it be to be in a world where you could take a medication and not have to worry about that, not have to worry about weight gain and some of the other things that people genuinely get concerned, like, do I have to choose my mental health over my physical health? I just can't wait for the day where that's not an issue anymore. And I'm hoping that medicine is getting closer to that. What do you think?
I think that is where a lot of the work is being done, for sure. I mean, I'm not a scientist. I'm a clinician. I obviously like to read about the science and attend the conferences and listen a lot. Listen to my patients, to the families, because then you understand the journey. Because in this journey, you are partnering with them. You cannot do it for them. You're doing it with them. So I do believe that is where things are moving and evolving. And if we do go back to the days where we had the Thorazine and it's like saying you had one antibiotic, penicillin.
Right.
And if you have an allergy to penicillin and you have a life-threatening thing that only responds to penicillin, I'm sorry,
bad, right?
There's nothing more we can do right now. So there is movement. It does feel like we haven't seen too many changes beyond some improvements and iterations, but the actual breakthrough of insight and something which can push the trajectory so that my fantasy. I was just telling this the other day to someone. I don't even know if it should be appropriate for you.
Yes, no, please do. That's what this is all about.
My fantasies would be, I guess, the following, almost in order of preference, maybe not. One fantasy would be that, a practical fantasy, that, insight, the capacity to begin to recognize, introspect, and then be able to then act on those. That itself is something that the medication and treatment will begin to shift over time, because once that's there, because it's not what we do, it's why we do it. Mm-hmm. And once the why begins to fall into place for an individual from wherever they're coming from, and then they may have their sense of medications in general, or the world, or anything else, or stigma or not. We can work through all of that if we have the foundation of somebody is able to see why and then think differently about it. In fact, even with what we do today, a lot of time and treatment is spent on understanding what is the patient or their family's what and why, and how do we kind of connect to that, and where do we help to work with that, and where do we try to shift.
And how do we end up at that place where people have their ability to do the what and the why.
Right, which is why just writing a script and asking a patient, I'll see you in 2 months from now, is never the way in which we could approach this. But so that would be, I guess, my fantasy.
Yeah.
The other fantasy is specifically with primary psychotic illness, schizophrenia, bipolar. And this is where I'm, is could we push this to from 17, 18-year-old as the age of onset to 95, 97-year-old? Can we delay? Not that I should want anybody in aging have it, but the course of that illness feels long, and for young people to be able to navigate life, with this idea that,
it happens at such an unfortunate time.
It's a time when they're launching.
Yeah, they're launching. They're trying to go to school. They're trying to start a job. It's horrible for families because they're still kids at that age. And
I do want to just gently go back to this concept that that's what the treatment is about, to allow that to happen to its maximum potential.
And is it true that for folks that do have a delayed onset for these disorders, that the severity tends to be a little bit less severe? Like if someone develops a psychotic illness at 30 instead of 18 or 19, is there any difference in the disease in that way?
I think I'd answer the question from the other end. Mm-hmm. When they develop the illness earlier, like when you really see patients, because there's so much overlap with so many other symptoms in the beginning. It looks like inattention, it looks like ADHD, it looks like just anxiety, it looks like depression. It's almost like, there's the chatter and the ingredients, but it's not,
Right.
formatted itself into this. So, but in some individuals, we actually, even as early as age of 8, 9, 10, 11, you can start seeing. So those individuals tend to have a more severe trajectory.
Okay.
When individuals are having something happening in their 30s and 40s, which is out of context to where it usually happens, then you also want to be, step back a little bit and say, what else could be going on? Is this just postpartum related, or is this something else? So in each decade that you go, when you see the illness as a new onset in later, then you just want to step back a little bit and just see what else could be the case, or is this primarily psychiatric?
And and ask more questions, I'm sure.
Ask more questions.
And maybe do some more diagnostic imaging and stuff like that. So clearly you're so passionate about the work that you do. You've been in the field now for many years. What does it do for you personally? What keeps you engaged in this line of work where you've decided this is where I am, this is where I'm staying, and this is what brings you joy and satisfaction in the work that you do?
I mean, what can I say? I really love, I think and I mean it in all sincerity, it is very humbling, and it is a gift to be on this side of the equation. It is truly a gift to know that you are involved in caring for and helping, because you could also be on the other side of the equation, no matter who you are. It is the most democratic thing, perhaps more democratic than democracy itself.
It's equalizing, right?
It's equalizing. There's no truly caste, race, creed, gender, political, anything. It is a gift, and to be on the side where you could understand and then be able to, in some, the other thing, I think, so that itself. The other thing is, it is a journey that only the people who have actually experienced, been through, either from the lens of the patients, the loved ones, people. So the understanding and what it does to in the journey, not everyone really is able to see and experience that. I mean, even though, thankfully, we don't want people to get cancer, but when you there's a visual that can come when someone says, oh, I'm going to have an appendectomy, and not to mitigate these, because if I have appendicitis, I am so grateful modern science can say, this is what we're going to do for you, and the surgeons, I am like, thank you, God.
Yes.
You're here.
It's important.
It's so in no way minimizing that, but the psychological, psychiatric universe, when the people varying experiences that they have to go through, the layers of the journey that they have to go through. So to be a part of it, I think I'm, again, I just, I'm deeply grateful. So I because it's not a journey that everybody can do, and it's a journey that you have to be there for, because otherwise there isn't anything. It's a journey where treatment is an evolution. It's a longer journey. If I've seen a patient at 20, in my fantasy, I'm seeing them in their lives continue to have touch points at 30s and 40s, and the idea that one day that will not be the case is another wonderful kind of hope for the future. But yeah, that, I don't know if that kind of explained, like I just...
Definitely. And I a few things. I love the idea of if we can push the onset to 95.
Oh, I'm not, just to be very mindful, let us not...
It's not on the horizon.
No,
but.
And also not the population that, I mean, I can safely say I am not young, far from it. So
We don't wish this on the elderly.
exactly.
However,
I have to be very mindful of that caveat.
Yes, if we can't get rid of the illnesses altogether, and they were going to happen inevitably to someone, wouldn't it be nice if it didn't have to happen?
If we could postpone that trajectory.
Exactly. When they're kids, when they're just kids. And the other piece about, you can never really truly put yourself in someone's shoes because you haven't experienced what they've experienced. And as clinicians and doctors, I'm sure there are some who have had experiences themselves, but the best we can do is seek to be empathetic and do the best we can with trying to imagine what it's like to be in that person's shoes and then be a support that's there with them every step of the way.
Yeah. And another very beautiful but also challenging part of this journey is there is no one human being, one person. The doctor is not it's like a spoke and a hub, and it's like a wheel. So there is a village that has to be there, and our mental health systems should ideally start seeing these illnesses from this concept of a village, because at various layers there is that the care that comes. And it's not that the person with the illness is in any way dependent on this village, but just that we thrive better in any setting, whether it's illness or not, when we have those kind of like support and this particular illness, definitely everybody matters. The person who's making the food, the person who is sleeping, the RC who's staying over, and everybody kind of comes together in unison. I mean, when I learned classical Indian dance, it's a very solo performance when you learn classical Indian dance. But my teacher first began to experiment with doing it in groups, and we kind of started back then seeing you're an individual as a part of a whole. I think that sort of very much describes how I one other piece that I really love about why I would want to be in this field. You are something that is part of a whole, so the individual matters, but in connection with the whole.
We need each other. Suma, thank you so much for being here today. I feel like I learned so much about you just as a person and the way that you think about this incredible field that we work in and the the stuff that we see every day. But it's just, as you said, it's as complex as the universe. And I also hope that with time we'll just continue to peel back all of those layers and learn more and more and more. And it may take generations to get there, but knowing that you come from this amazing family history and what you've brought to us, thank you. Thank you for being here.
Thank you. My pleasure.
You've been listening to Conscious Mind on Silver Hill Radio.
No, don't worry. I can cut all this stuff out.
Okay.